Hi, everybody. Good morning. I'm going to hang on a second here to get some of you guys here online. I'm so excited to talk to you about this today. I love doing lives because I just kind of get inspired by stuff that I research and read. And today I want to talk all about estrogen and some of the little known facts that you may not know about estrogen and what it does to your body. So let me give you some background. For those of you who don't know me, I am Dr. Mary Claire Haver. Good morning. I am a board certified OB-GYN. I get a little flack for saying board certified, but y'all, I work freaking hard for that certification. And there's so many quacks out here on TikTok who are claiming to be health experts. So I want to make sure I have my credentials front and center. I graduated from medical school from Louisiana State University Medical Center in 1998, and then completed my residency in Obstetrics and Gynecology from the University of Texas Medical Branch in 2002. And I've basically been a practicing OB-GYN ever since. I did take a little sabbatical to go overseas where I didn't practice formally. I was supporting my husband in his position, but I did do some freelance work while I was overseas. But I couldn't practice in Venezuela because Hugo Chavez would not recognize my medical training. So thank you guys all for joining. So I just did a TikTok all about estrogen. So, I think people are pretty well aware of estrogen and its effects on reproduction and what it does from a sex hormone standpoint. But what I want to talk about today is some of the things you might not understand about estrogen. And let me tell you, these are not things that were taught to me in medical school or residency. This is kind of cutting edge research on the metabolic effects of estrogen and what happens when our estrogen levels start declining. So let me be clear. Normal reproductive function is when you're living your best life, you're having regular periods, everything's normal. Our estrogen levels are not steady state. They fluctuate throughout the month with our periods. They peak at ovulation, and then they decline as our periods come, and then they slowly build up again, and the whole cycle repeats itself. Now, certainly if you are polycystic ovarian syndrome, this does not apply to you. If you have premature ovarian failure or other metabolic issues, this may not apply to you, but for everybody else it does. Now, there's a phenomena that starts happening for most of us in our mid-30s, late 30s, early 40s, where our estrogen levels start declining as a function of perimenopause. Now, here's the problem. We are terrible about diagnosing perimenopause as physicians. We don't have a good blood test for it. And the estrogen levels don't decline in a steady state. They decline erratically. So they kind of go up and down, but it's a downward trend over time, okay? So when our estrogen levels start declining, our patients come to us and say things like, I don't feel so good. I'm not sleeping as well. I'm gaining weight. I'm gaining weight in my abdomen. My joints hurt more. I'm having heart palpitations. I'm having exacerbation of my mental health issues. I'm having new mental health issues. All of these things start happening. And doctors kind of go, it's not menopause yet. We're great at diagnosing actual menopause. Period stop, estrogen has shut down, FSH levels rise, follicular stimulating hormone. We're great at telling you, yes, you're menopausal. But perimenopausal, we don't have a great test for that. So a lot of doctors are stumped. It can't be menopause, but it certainly can be perimenopause, okay? So here are things. There are 7 things I want to talk about, and I can provide the research. If you go to estrogen signaling and metabolic inflammation, this is the article I'm talking about today. It is in Mediators of Inflammation from 2014. You can do a PubMed search on estrogen and inflammation, and several articles will come up. Okay, so number 1, and you're going to see me, I'm going to move this over here so I can see my notes a little bit better without bugging you guys too much. So there is extensive evidence, guys, supporting the interference of inflammatory activation with metabolism. We know this, right? Obesity, mainly visceral obesity, so our visceral or belly fat is associated with a low-grade inflammatory state. Okay, so as our abdominal fat rises, our inflammation levels rise. And the visceral fat, not the subcutaneous fat, that's the fat amongst our hips and thighs. It gives us cellulite. It's cosmetically distressing, but it's not inherently dangerous unless you have so much of it, it affects your joints, okay, and you can't move. But visceral fat, the fat that wraps around our omentum, around our internal abdominal organs. That fat is metabolically active and it promotes inflammation, and it is dangerous. So what does estrogen have to do with all of this? Okay. So this article goes on to like break estrogen down, talk about where estrogen is produced in the body, the 3 types of estrogen, which are estradiol, estrone, and estriol. And then estrogen signaling, the signaling pathways. This is a medical journal article, so it gets down to the nitty gritty. But here's kind of what I want to break down for you. How estrogen affects signaling in metabolic inflammation. Okay, so this is going to be a light bulb moment for some of you. I want you guys to hang on. I want you to share this. I want you to try to hang in there with me. Estrogen, turns out, is a powerful, natural, anti-inflammatory hormone. Okay, so when we start having declining levels, our inflammation levels go up. Estrogen affects energy balance. So in medicine, when we talk about energy balance, we're talking about calories in, calories out, okay? So for those of you who are calories in, calories out and have been successful with it through your 20s, you'd starve yourself for a little while, you get back in those jeans, all of a sudden it's not working. All the little tricks you did don't work. Here's one reason why. As our estrogen levels decrease, how we maintain our energy balance decreases. So the calories out factor starts changing in reflection of estrogen levels. So we're not as efficient anymore. So you aren't burning as many calories as you did before. So you've done nothing different other than start going through menopause. You're eating the same, you're exercising the same, but you're gaining weight, and you're gaining weight in your midsection where you never have before. Estrogen influences energy balance by opposing excessive body fat accumulation. Okay, estrogen fights to keep you from storing excessive body weight. Multiple mechanisms account for this activity, including actions on the central nervous system that regulate food intake and expenditure. Remember, leptin and ghrelin are the hormones that control our satiety and our hunger. If we're full, or if we have a drive for food. Estrogen affects how leptin is produced in our fat cells. It's basically the starvation hormone. It's a thermoregulator. So when our fat cells are happy and full, it produces leptin. And it says, hey, we don't need to eat. Okay, we're good. There's nothing, so it puts a damper on our hunger. It says, I'm full. The brain is like, we're good. We don't have a drive for food right now because we have plenty of fat stores, okay? Estrogen makes that process work efficiently. When our estrogen levels decrease, the brain starts having trouble recognizing the leptin signal. So our fat cells are producing leptin, but our brain is like, is it really saying that? I mean, I think we should eat something. I think maybe we should go ahead and have a meal because I'm not really sure if I'm hearing that signal that there's enough fat cells. So estrogen also decreases food intake by affecting ghrelin. So ghrelin is our hunger hormone. Ghrelin is produced in the lining of the stomach. It's an immediate thing. It drives us to our next meal. Whereas leptin is more of a long-term hormone, kind of sets a thermostat for the balance of fat distribution. So estrogen has dramatic effects on both of these hormones affecting our energy balance and metabolism. So did I over-explain the science? Are you guys following me? So I love talking about this stuff. Okay, I see a little yay. So yeah, feel free to share this video. If you don't follow me, please follow me. I love talking about science. And if you want to learn more about your body and estrogen and hormones and science and nutrition and all the things, just please follow me. So in the studies when they do oophorectomies, when they take out the ovaries on the animals, okay, it leads to increased fat deposition or adiposity, partially by increasing food intake. And then when they give the oophorectomized animals estrogen back via hormone replacement therapy, that stops. It's pretty amazing. Okay, so remember, number one, estrogen is a natural anti-inflammatory hormone. Number two, estrogen decreases food intake by affecting leptin and ghrelin. Okay, it also favors energy expenditure by subconsciously driving physical activity, driving you to move. So when your estrogen levels are normal, premenopausal, we have a natural, more of a drive to get up and move around. Okay, as we go through menopause and as we go through perimenopause and our estrogen levels start driving, we see a decrease in energy expenditure because the drive to move is less. Hang on one second. So I'm just looking at my notes here, guys, real quick. I have a little bit of a sore throat, so I apologize for that. Okay, so here's another phenomena that happens. Estrogen stabilizes lean body mass. Okay. When we hit our 30s, our muscle mass tends to peak in our 30s. And then the body starts driving, it's called sarcopenia. It starts driving us to stop laying down as much muscle. So muscle is kind of something that we are constantly remodeling. We're putting down more, we're taking some away. It's like bone. Bone, we're constantly remodeling. As well. The bone you had at 20 is not the bone you have at 40 because you're constantly chewing it up and laying down more. Muscle's kind of the same. And so we start increasing the rate at which we break down muscle versus what we lay down. And estrogen seems to have a big effect on that. So estrogen helps us hang on to our lean body mass, which is important because our lean body mass is what drives our basal metabolic rate. It drives our metabolism, okay? Estrogen decreases the amount of belly or visceral fat accumulation. So I'm talking about, again, the visceral fat, the belly, the fat that is under our skin, wrapped around our organs. It's metabolically active. It's a constant source of inflammation. It's terrible. And so as we start having decreasing estrogen levels, the body will start driving more fat under the decrease of estrogen to the viscera, to the abdomen. And then finally, estrogen is very protective against cardiovascular disease, type 2 diabetes, and actually certain cancers. So what can you do? What can you do about it? And if you guys have questions, just place them in the little question box down below, and I will get to it. So not everyone is going to be, okay, so what can you do? We're all going to go through menopause, every single one of us, if we live long enough. This is 100%er. Nobody gets out of life, besides premature death, without decreasing estrogen levels. So we are all going through this. Me, you, every single one of us, unless you're 25 and happen to be watching this and being like, I don't know what this lady's talking about. Good for you, sister. Enjoy it while you can. You're going to be back here in 10 years. Okay. So for those of us, what can we do to battle this? Well, number one, your nutrition always first. Guys, nutrition first. Stop looking for a supplement. Stop looking for a pill. Stop looking for a potion. Your nutrition needs to be on point. Stop eating out of bags and boxes. Stop eating ultra-processed foods. Stop taking the nutrition out of food for convenience, okay? Focus on your nutrition first to make your body work more efficiently. If you're looking for a program, shameless plug here, check out the Galveston Diet. We are at galvestondiet.com. Happy to have you guys learn more about it. Okay, nutrition first, always, always, always. Then exercise. You got to get up and move that body. You have to move your body. You have to do cardio and resistance training, especially at our age. Okay, now I'm talking about women 35 plus, okay? Cardio is not enough. Stop thinking about calories in, calories out. Start thinking about your metabolism. Start thinking about your muscle mass. You must lift things heavier than yourself in order to hang on to your muscle mass, which is driving your basal metabolic rate and your metabolism, okay? Nutrition, exercise. Finally, if you're a candidate, consider hormone replacement, okay, or hormone therapy. I hate calling it replacement, okay? Studies are showing the earlier you start, the better. Now, hormone replacement is a little sketchy as you get into your late 60s, 70s, 80s, okay? Not many physicians are recommending that. But from a younger age, like in your 40s, when the estrogen levels start declining, supporting that decline with replacement. Now, I'm not talking about testosterone. I'm talking about estrogen or estrogen plus progesterone. If you've lost your uterus due to surgery or whatever, or you don't have one, then you can just do estrogen. If you have a uterus to protect it from endometrial cancer and endometrial hyperplasia, you must have estrogen plus progesterone, okay? You can consider hormones even if you're not fully menopausal yet. And that seems to be where the biggest benefit is, especially for the visceral fat accumulation, okay? So this is not Mary Claire, doctor. I'm not your doctor. I'm just Mary Claire. I'm here to be an advocate, to be a friend, to be an educator. I cannot determine if you are a good candidate for hormones or not. Not everyone is, okay? It depends on your age, your risk factors, your symptoms, your family history, your medical history, your social history. All of that is an intense discussion with your gynecologist, okay? Here's some advice. If your gynecologist won't even discuss the option with you, if they say, I don't give hormones to anyone, then I suggest you get a second opinion. Okay? If your gynecologist will not discuss the option of hormones with you because they have a personal bias against them, then I suggest you get a second opinion right away. Okay? All right, I'm going to go to the questions now to see what kind of questions you guys have. Not everybody's a candidate, remember, okay? There are other things you can do for the symptoms, but to get the metabolic issues, nutrition and exercise, decrease your stress. Nutrition, exercise, decrease your stress, okay? All right, here we go. How do you increase estrogen? Well, buyer beware. There are a lot of people who are going to tell you that they're going to give you all of these different potions and pills and creams and drinks and things that are naturally going to increase your estrogen. Listen, our ovaries are on a path of self-destruction from the day we're born. We cannot avoid this. You may be able to eke it out for a little bit here and there, but our ovaries are going to stop working. You cannot get away from this. This is going to happen. There's a huge genetic component to when that's going to happen for you. There's also environmental component, okay? So if you smoke, you're more likely to go through menopause sooner. That's a huge environmental factor. We know that. So you will start going through perimenopause sooner. Let's see. I'm looking, how do you increase estrogen? So the other ways to increase estrogen is to take an estrogen, is to somehow put an estrogen back in your body through replacement. So but that again is an individual discussion between you and your physician. There are several options. There are rings. I love a vaginal ring. They're just so freaking expensive, but it literally, I would have all of my medications in a vaginal ring. Just throw that dude up there and let him sit and let your body absorb the hormones or the medication, whatever. But they're just prohibitively expensive because probably we're women. If there was a ring that a man could put around his penis to get all this hormone, believe me, it would be free. Sorry, I'm a little bit biased and a little bit judgy and mean when it comes to male versus female healthcare because I think we get the shaft. But anyway, okay. Okay, what foods are high in estrogen? None. But there are things called phytoestrogens. Okay, so don't be confused about estrogen and a phytoestrogen. Phytoestrogens are naturally occurring substances that have estrogen-like compounds and may weakly bind to estrogen receptors. It is not an estrogen, okay? So these are things like isoflavones found in fruits and vegetables. Soy is rich in isoflavones. There are a few out there. There are a few that are extracted and put into over-the-counter herbal supplements that some women find helpful with some menopausal symptoms, but certainly not with all the metabolic issues I was talking about earlier. They can be somewhat helpful for hot flashes and night sweats, but that's about it. Okay. St. John's wort has been shown to be helpful with some of the mental health issues associated with menopause, but it's not going to raise your estrogen levels. Let's see. I'm going to the questions here. Should I do hormone? That is again, I am not here to tell you if you should do hormones or not. I'm here to arm you with information and to educate you so you can take this information to your physician and give a logical discussion on why you would consider hormone replacement as a prescription. Okay. How do you increase estrogen? You need to basically take it exogenously, in whichever method makes sense for you. How to increase progesterone? Well, you need to ovulate. So if you're not ovulating, then you need to take a progesterone supplement. Now, there is something called a luteal phase defect where you don't have a robust ovulation, kind of. And so you end up having lower levels of progesterone. And this is usually diagnosed by having a short luteal phase, which is the second half of your cycle. So less than 10 days or less from ovulation, you're having shorter periods, is usually how a luteal phase defect. It's also linked to infertility and recurrent miscarriage. So that's usually how that stuff is diagnosed. Let's see. Warm wave sensation in pelvis, a symptom. Well, that could be a lot of things. Is this a good thing or something that bothers you? I would talk to your physician about that. I can't answer that question. How to help Cody with osteopenia. So I think you're asking about osteopenia, which is related to osteoporosis. It's a precursor to osteoporosis. How do you help with osteopenia? There's several things you can do. You need to make sure you're getting enough calcium and vitamin D in your diet to increase the calcium absorption. You need to do weight-bearing exercise. Is probably the most important thing that you have, but there are certain genetic components you can't do anything about. So then you talk to your physician about medications that can help. So as we go through menopause, estrogen has a strong effect on, so remember I said earlier, bones are constantly remodeled. We're constantly chewing up bone and laying down new bone. It's like Pac-Man. Pac-Man's doing like this, and then we're spitting out new bone over here. This happens faster in menopause. As our estrogen levels decrease, we chew up more than we lay down, hence osteopenia and osteoporosis. And so weight-bearing exercise, absolutely, resistance training and making sure you have enough calcium in your diet are two of the most powerful things you can do as a layperson. And then, of course, talk to your doctor about some prescription medications. Signs perimenopause has begun. So we typically don't see irregular cycles until kind of the end of perimenopause, but you can see, hot flashes, night sweats, weight gain, metabolic disturbances, increasing joint pain, increasing headaches, increasing nausea, increasing, tremendous metabolic effects as early as your mid-30s. Really, the thing is the women are most sensitive to this is the weight gain. They just start seeing, I don't understand what's going on. That was in my office, at least. This is anecdotal, is my patients coming to me and saying, I don't understand why I'm gaining weight. I'm not hitting the drug, I'm not doing anything different. I'm gaining weight and I'm gaining weight in my abdomen. This, late 30s, early 40s to me was one of the first signs of my patient population who would come in and they were starting to experience the signs of perimenopause. Okay. Autoimmune diagnosis after perimenopause diagnosis related. Absolutely. We see an exacerbation of autoimmune disease or a new diagnosis of autoimmune disease as the estrogen levels start declining. Because remember, autoimmune disease is inflammatory. Estrogen is a powerful anti-inflammatory, natural occurring substance. Let's see. Your hair is thinning at the temples and you're 45. Helps. So that's typically male pattern baldness. This may absolutely be hormonally driven. Remember, the activity of our testosterone and dihydrotestosterone increases as our estrogen levels decrease. And so that helps also drive belly fat to the abdomen. That's why I don't love pellets, estrogen testosterone pellets. And talk to your dermatologist. There's definitely some things that you can do to help with the hormone levels and also to just spontaneously help with the hair growth. Sorry, my voice is... After hysterectomy, do you need PAPs? It depends on why you had a hysterectomy. If it was for benign reasons, remember, a PAP is just a screen for cervical cancer. A PAP is not a pelvic exam. Everyone needs a pelvic exam. Someone needs to look and feel down there to make sure there's no cancer growths. It's like looking in your throat, okay? So because you had your tonsils out, do you still need someone to look in your throat? Yes. So it's the same thing. A PAP is not a pelvic exam. A PAP is just the scraping of the cervix to screen for cervical cancer. So if you had high-grade dysplasia or it's a hysterectomy for non-benign reasons, you probably still need to have the vaginal cuff papped. But that's not a pelvic exam. You still need pelvic exams after hysterectomy. No further questions. A big thank you. You're welcome. I love these talks. Please share this. Please follow me. please check us out at galvestondiet.com. I would love, love, love for you guys to learn more about our nutrition program, about our support for women's health and wellness. I absolutely would love to talk to you guys about that. So if you go here in my little thingy, you can check on my link in bio there. There's a link at the top of the page, or just Google us at galvestondiet.com. No problem. Oh, and if you're interested in our program, you can save using the code TIKTOK10, TIKTOK10, to save 10% off of all of our programs if you're interested. We'd love to talk to you about that. Do I see patients in person? Not really. I'm a hospitalist. So my work with the Galveston Diet and my work, now is mostly online. And so my malpractice carrier, I cannot do one-on-one visits. I don't have a license to do remote visits, like I'm not credentialed to do that. And so I work in a hospital on an emergency basis. So I cover the ED, I cover labor and delivery, I deliver the babies, I do all the consults, I work in the ICU, I do whatever is needed in the hospital basis. So I don't have a clinic where you can come and see me. But if you need a recommendation in the area, I have some great friends who are here who I can recommend. So just email us success@galvestondiet.com, and I have a list of doctors for you to see. Can a 62-year-old take hormone replacement therapy? You can do anything you want in the world. You may not be a good candidate, so that's something you want to talk to your doctor about, but it's not a categorical no by any stretch. Hysterectomy soon, suggestion hormones. If you're having your ovaries removed, then you definitely want to consider hormones, absolutely, but that's an individual conversation between you and your doctor. Will you post the savings? So it's TikTok10, TIKTOK10, just the way the app spells it, TIKTOK10, TikTok10, to save 10% on all of our, okay, let's see. What should I do about chronic use for 40 years? I don't know what you're talking about. I'm sorry. Can you give me more? Does tubal removal cause earlier menopause? Hysterectomy, after a hysterectomy and your ovaries are left in place, that you go through menopause about 1.5 years sooner. But after your tubes are completely removed, I have not seen data to suggest that you would go through menopause significantly earlier. Estrogen is good. Yay, I'm glad you feel that way. I do too. How to get rid of unwanted hair? Since I'm Cajun and have dealt with unwanted hair most of my life, this Mediterranean descent, I have had laser treatment on my lip, on my bikini. I've had it, I paid for my girls to have it because I didn't want them to go through what I went through with the ingrown hairs and all the drama. Wax, pluck, remove. There's Vanica if you can get it, but it only works as long as you use it. But there's some great options if you can afford it for permanent hair removal that I would highly suggest. Can perimenopause cause fibromyalgia? So fibromyalgia is a inflammatory condition, and we do see exacerbation of almost all inflammatory conditions once the estrogen levels start declining in perimenopause. So will it cause it? I don't know if it causes it, but it certainly can suppress, estrogen can suppress it. What do I think about bioidentical hormone replacement? I think it's fine, but I don't think it's any better or worse than any other kind of hormone replacement therapy. You do you. You and your doctor decide what is the best option for you. There are some pharmacologic bioidenticals out there that are great as well. But I get a little nervous when people start whipping up stuff in the back office, pills and potions and pellets and these things that are not FDA approved. I'm always going to recommend the FDA approved choice first. Now, and only to delve into things that are not FDA approved if the others aren't working for you. Because I like testing. I like testing for safety and efficacy. I think it's important. Okay. What time of day do you take vitamins during a fast? If I take my vitamins and my supplements during my fasting period, I get horribly nauseated. So there's nothing wrong with doing that. It doesn't agree with me. So I take my supplements when I break my fast. After I break my fast, rather. And that's when I drink my fiber and my collagen as well. 51 starting menopause, will hormones help? Yeah, they will, 100%. But you know, there's a lot of things, you know, you have to be patient with some of the things that it can help. Some of these things developed over years, and they're not going to be reversed overnight, like the belly fat. Let's see. Menopause symptoms ebb and flow. Yes, because remember, in perimenopause, our estrogen levels decline, but they're very erratic as they decline. So you will have an ebb and flow of your symptoms all through perimenopause. You'll have months where you feel fantastic. What was I thinking? What was all that about? I must have had the flu. And then you'll have months where you just, oh my God, what's happening in my body? I'm changing. I'm growing hair. I'm losing hair. All these things are happening. I'm hurting. I can't sleep. You know, and then you're fine again. So yes, absolutely, they ebb and flow. And then menopause, once you're, you know, everything stops, then those symptoms can kind of ebb over time, typically. Let's see. Yes, I fast every day. I'm fasting right now. Yes, I practice fasting every single day. It is a habit for me. It is something I've built into my life and that I absolutely love. Okay. I am going to wrap this up. I had a great time talking to you guys today. Hopefully you go and watch my TikTok about estrogen, and I'll come on again soon. Thanks so much.